Arthritis is a chronic and progressive condition and is characterized by the loss of cartilage in a joint. A normal joint has cartilage on both sides, and with time, genetics, age, wear, it starts to thin out, causes an inflammatory response in the joint, which causes pain and swelling and stiffness. And as the cartilage wears more and more, it gets to the point where it starts to become bone-on-bone arthritis. And when people get to the point of bone-on-bone arthritis is when we start to think about a joint replacement, because usually at that point the non-surgical measures don't work. A lot of patients come see me for pain in their hip or their groin, sometimes in their buttock, and they're coming, either to see me for a first time and get this evaluated, or they've been referred to me for consideration of a hip replacement. The hip joint itself is actually more located near the groin than the outside part of the hip. And so when I'm thinking about if someone may be having hip arthritis, it starts with hearing where their pain is. A lot of times patients with hip arthritis have a hard time putting on their socks and shoes. They have a hard time getting out of a car, getting up from a low seat. And those things kind of trigger me into the fact that their arthritis is causing their issues. When they have arthritis on the x-ray and those symptoms that match up with it, then we start thinking about the treatment options that you can do for hip arthritis, whether that's non-surgical or surgical options. I use computer navigation software for all my hip replacements. The benefit of that is it allows me to put the patient's components in the right position for them. Things that used to be a problem with hip replacements in the past were increasing leg lengths due to the need to provide a stable hip joint, and by increasing the leg length, that could allow the tissues to get more stable during the surgery. Now that we have software like this, we can make sure that we're not lengthening the leg too much and we're putting the components in the right position for the patient to minimize risks of things like over-tensioning the tissues, lengthening the leg, and importantly, it allows us to make sure that the components are in a good position to reduce the risk of dislocation. After hip replacement, dislocation, although is less than 1% chance, is something that is a tough complication to deal with for both the patient and for us. And so if we can use a software to make sure we're putting the components in the best position, we can reduce that risk and hopefully try to avoid that as much as we can.